cancer. By cancer, they are the cells rapidly growing. And normally cells are at one place in the body and they're doing their task, what they have to do. These cancer cells are not doing that. They are rapidly growing and also spreading, going to other places. They can go, they can invade other tissues, growing over the tissue about to be invasive, having malignancy, then be invasive to besides to other organs, or spread over the lymph and blood vessel system to other places in the human body. And they are a waste of things in the human body, and over time they lead to death if treatment isn't successful. And some other things general about cancer. Every second person statistically gets cancer in their lifetime, and the older the person gets, the more likely is it that they get cancer. Some cancers also have children, like leukemia, cancer of the blood, or cancer of brain or bones. Men and women have cancer overall equally. There are some cancers which women more have or men more have. And also some causes are named here, what cancer can cause. There is said in this book from the 80s, from 1982, that there are some suspicions towards some chemicals, maybe in the food, in the air, and the water. Some people who work with such chemicals might get more likely cancer. And then there's also said cancer is not hereditary. There are some things which make it more likely that some children get it more likely, but it is not hereditary. And there are some viruses which might cause leukemia or neck cancer, but in general, not so much. The main thing is cancer is not infectious. So there are some viruses which can cause cancer, but cancer itself is not infectious. And then we have studied something to the terminology. They said neoplasm, that is just the growth of new cells, which are useless. And tumor is it when it's bigger, to be felt or seen. And carcinoma are the cancers called of the tubes of the gut of the bronchi. And sarcoma are the cancers of the connective tissue, of the muscles, bones, ligaments. And they can have malignancy, that means that they are invasive to other places. And they can be malignant or benign. And malignant means that they are doing that invasive stuff, and benign means they're doing that not. But some benign can turn malign, so they're sometimes removed when they are benign. What symptoms do they cause? A bunch of symptoms. Cancer oftentimes just causes symptoms as soon as it is advanced to be destructive. And there are some general symptoms like loss of appetite, some fatigue, some mood changes, and weight changes, but also some other things like blood or mucus in the feces or in the urine, or other things. And now what can be done against it? Now the first important thing is the earlier the better. The earlier the cancer is found and treatment is started, better. Now what can be done? There is the idea of surgery, then it is just cut it out, maybe then in combination with radio or chemotherapy. So cutting it out, surgical, is an option. Another option is to make a radiotherapy. Cancer cells are more susceptible to X-rays, and therefore they're getting more. And also chemotherapy, where also these medications or whatever they are more infectious, more stronger going onto the cancer cells than on other cells. And how is it found out? They can be made X-rays, they can be swallowed a dye, which is then taken in stronger by the cancerous cells as the other ones, and then it can be seen on the X-rays or something. And other things, they can be made biopsy of the cancer itself, have things taken out and then looked under a microscope under it. And they can be looked into little specks of blood in the feces. They can be made then tests of a cervical smear for cancer at the neck of a womb, or testing the urine, or other things. And this is what your written is. And they are basically ending with advising with if in doubt, find it out. So they're saying the earlier it is found, the better. And if someone is doubting that maybe a mole is turning cancerous or some things or something like that, if in doubt, find it out, do they say. And early finding, screenings, checking for some things regularly might help to find it earlier and to have it earlier. And they're also saying that, and that already in the 1980s, that they are working on treatments and that they're making advantages to be able to cure and treat more and more cancers. So, and that is all according to the Reader's Digest Family Medical Advisor written by Keith Hodkins in the year 1982 on the pages 106, 107, and 108. But this is no substitute for medical knowledge and also no medical advice. Hi, Rebecca. I'm trying to learn oncology, today cancer, and after we've done that, we're going to do extensor kappa Illinois strength training. And if you participate in the extensor kappa Illinois strength training, that's at your own risk. And we're going to talk about cancer and internal anatomy. And this is no medical advice, I'm just trying to read and to understand it. And the book is from the 1970s. Cancer. Cancer is not a single disease. It is a process that can affect any organ of the body, and each one will have different symptoms and different prospects for recovery. Cancer is a disorder of cell growth in a part of the body. Okay, it is not just a disease, it is a process. It is the growing of the cells is working wrong in a part of the body. Each person has different symptoms and different prospects for recovery. The human body is made up of billions of microscopic cells, each with special roles and duties. Normally, each is orderly in growth and reproduction, but in cancer, cells in a part of the body become uncontrolled. They multiply rapidly and look different from normal cells under a microscope. Because of their growth, they form a swelling which may become ulcerated. Okay. So there are, in a human body, are billions of little cells, and they're all having a specific role and duties, they're doing things. But by cancer, they are out of order in growth and reproduction. They are growing uncontrollably. They're multiplying rapidly and also look differently. And because they're growing so much, they can be seen as a swelling because they become more. It swells, the whole mass of it becomes more. Normal cells know their place in the body and remain with... Oh, it is something interesting. Normal cells know their place in the body and remain within the limits of the organ of which they form a part. But cancer cells know no such bounds. They invade adjacent tissues and destroy them. Okay, normal cells are just there in the one place where they are. But these cancer cells, it's not just that when the muscle gets bigger if it is strained or something, that one organ gets bigger if a cell is growing, and also only in a normal amount. But cancer cells don't just stop with growing at the one organ, they're going over and grow the other organ. This excessive growth is not only in nearby tissue. Some cancer cells penetrate the blood and lymph vessels and spread to more distant organs, such as the lungs, liver, bones, and lymph glands. They establish new cancer colonies. This moving and settling process is called metastasis, the transfer of disease from the primary to a secondary part of the body, and the distant colonies are called metastasis. Okay, they're not just going to the other colonies, they're also going into the blood system and then running around in the whole body, and wherever they can, they're driving off the lane and start to grow there. At the lungs or liver, bones, lymph. And that is then called metastasis. And there they are then making colonies, that is called metastasis. With such hectic, disordered, and uncontrolled cell activity, the body's energies are misused and wasted. If this continues unchecked, it will use up all the body's reserves and result in death. But modern treatment can cure more than 30% of all cancers. Okay, they are misusing the body's energy and wasting it. Now, it was mentioned in some other parts of this book already, which we're doing in medicine, that cancer can have an influence in that the person suddenly loses weight or something, because energy is used for that. Who is likely to get cancer? Let's see here we have an early warning checklist. The following signs can indicate the presence of cancer at an early stage. If you notice any of these symptoms, see your doctor at once, as early diagnosis increases the chance of successful treatment. So we're saying here, calling up of blood, passing of blood in the urine, passing of blood in the motions, persisting change in bowel habits, either constipation or loose motions, blood-stained discharge from the vagina, vaginal bleeding between periods, after intercourse or after menopause, persistent core, lump in the breast, lumps in the neck, non-healing sores, ulcers on the skin, especially the face and hands, which are more exposed to the sun, unexplained persistent tiredness, unexplained loss of weight, unexplained indigestion. Okay, and the earlier these things are noticed and told to a doctor, the more likely is it to cure it or to treat it. Who is likely to get cancer? Although cancer can occur at any age, the disease tends to become more likely as people grow older. From 40 onwards, the likelihood of getting cancer increases considerably. In any year, only 3 people in every 1,000 develop the disease of 40. 9 people in every 1,000 at 60 and 18 of 1,000 in 80. So the longer a person is affected by aging, the more likely is it that they get cancer. The reason why aging cells are more likely to become cancerous is not yet clear, although current research into the problem could provide a solution in the foreseeable future. Okay, we're saying it is not known why older cells are more likely to become cancerous, but we're saying that they are hoping to find in the foreseeable future the reason for it. The areas of research include the irritation of cells by smoking, harmful chemical reactions from certain foods, the lack of dietary fiber, the overexposure of skin to sun, especially in hot climates, and adverse reactions from industrial work with such materials as rubber and asbestos. Okay, we're saying one thing where they find out their cancer is causing it has to do with smoking, certain types of chemicals in foods, too little fiber in the diet, exposure of the skin to the sun, or in contact with rubber, asbestos, or things in industries. But despite this tendency to affect mainly the middle-aged and elderly, certain cancers such as leukemia, cancer of the blood, and cancer of the brain and bone occasionally develop in children. So also children develop cancer. In particular here named now leukemia, cancer of the blood, and cancer of the brain and bone. Cancer affects men and women almost equally, although certain organs are likely to be more affected in each sex. For example, breast cancer occurs predominantly in women and lung cancer in men who tend to smoke more than women and who generally start smoking at an earlier age. So men and women basically the same, but there are certain types of cancers which are more likely in women and certain types which are more likely in men. In Western countries such as Britain and America, that book is British, 1 in 4 deaths will be from cancer, while 2 in 4 will be from heart disease and strokes, and 1 in 4 from other diseases. Okay, 1/3 of the cause of death is cancer related or cancer, and half of the deaths is heart and stroke related, and 1/4 is something else. Although the exact nature and causes of all cancers are still uncertain, there are clues pointing towards the causes of special cancers. Family tendencies. Despite popular belief, cancer does not run in families and is not an inherited disease. However, there are predispositions which tend to run in families and which can bring on cancer. For example, in some families there is a tendency to a rare form of bowel polyps which can turn cancerous and which needs to be surgically treated as early as possible. There's also an incidence of lung cancer in families which smoke heavily. High risk of so we're saying, so the first thing is it is not inherited. It does not run in families, but there can be some tendencies. The 2 examples here named are who have very strongly to do with the environment. The bowel polyps, they could have something to do with what people eat, and that could be drastically different from family to family, and also the smoking habits can be drastically different from family to family. So no, it is not inherited, it is not like that, but it could be that there are some tendencies. The 2 named here are strongly with the environment and how the family lives, not their genetics. High-risk occupations. These occupations, which include some chemical industries and mining and poor safety conditions, predispose people to skin, bladder, and lung cancer. Okay, people who are working in areas with some chemicals or something, they are also more likely to get cancer. Chemical causes. It is likely, but as yet unproven, that certain chemical properties in food, water, or air can irritate some body cells and make them cancerous. The suspected danger lie in the excessive consumption of alcohol, eating raw foods contained by as yet unspecific substances, the possible radioactive and chemical contamination of drinking water, and air pollution in factories or at home, which is more likely to occur in cities than in the country. Okay, I'm saying here, written in the 1970s, that some ideas are around. I don't know exactly that there could be some chemicals in the food or water or air, that it can be that people eaten specific substances in the food, or that drinking of alcohol is an idea that might be something, and also radioactive and chemical contaminations of drinking water or air pollution in cities or something might be also something. Cigarette smoking. The medical world now agrees that there is a definite link between cigarette smoking and lung cancer. It is likely that the inhaled smoke from thousands of cigarettes over a period of 20 to 30 years in some skeptical people will irritate the cells of bronchial tubes enough for them to turn cancerous. So they're saying that most people who have adopted the degree are agreeing on that smoking cigarettes every day over 20-30 years causes the lung to turn cancerous. Infections. In some cases, infection can cause cancers in animals. Some children in Central Africa suffer from a neck cancer caused by a virus, and there may be other cancer-causing viruses responsible for some forms of leukemia and for cancer of the neck of the womb, cervix. However, cancer is not infectious. So first thing, really important, that cancer is not infectious. I think what I mean with it is that it is not to another person infectious. Because some people believe that it does not go on to another person. Mole and warts. Most moles and warts are harmless, but some may change their shape and color and become cancerous. Okay, we have here quite something left. 2 times as much as we read it, maybe even 3 times. That means if you were here for Oncology, you can go directly to the next part of Oncology. Then you will continue with the reading bit. And again, this was not medical advice, I just didn't try to understand it. If you stay here and participate in the extensor couple strength training, then it's really honest. Go to stable standing set, arms up from the fists and down. There you go. And I think 3 rules. Now hands are good, and now. The first rule is that we're going only as fast as we can go with a little bit of effort. That's the second one. The first rule is that we're stopping immediately as soon as there's pain. And the third rule is that we're going on, that we're not overdoing it. We just want to strengthen, not to exhaust. Now, a t-shirt, towel or sock, press onto it, and down. Again up. And down. And with your hand, press and down. And again up. Again down. And press and to the outside. In. And with your hand, press and in. And again up. And from the top, press evenly with all 5 fingers and the fist down. And again up. And with your hand, press down and up. And just press in neutral position. And the other side. And that was the extensor couple strength training. Thank you very much, and until next time.